Dear reviewers, my name is Alexios Dosis, and this is an abstract submission for a novel approach to preoperative risk assessment. Identifying high-risk patients is central to decision-making and improve patient outcomes for surgical patients. While the cardiopulmonary exercise test is currently considered the gold standard method for risk assessment, there are several barriers to its use. It is resource-intensive, not widely available, and it may discriminate against frail elderly individuals who may not be able to perform the test. As wearable monitoring is gaining momentum, we wanted to explore a more novel, inclusive approach to risk assessment using a chest-worn biosensor device. The remote monitoring system captures continuous physiological data with the patient at home and provides useful information that has the potential to guide clinical decisions. A single-center prospective feasibility study involving adult patients undergoing elective major abdominal surgery was conducted. Eligible participants were identified through multidisciplinary meetings and cardiopulmonary exercise test referrals. Participants were approached at the recipient appointment as shown on the flowchart. If agreed, they were fitted with a wearable sensor for 72 hours. Participants underwent surgery as planned as the study did not impact patient care. A qualitative sub-study explored views of patients and clinicians on the remote monitoring system. Collaboration with the School of Computer Science focused on analysis of raw wearable data for fitness estimations. Recruitment to the study was consistently high and the target was achieved ahead of schedule. Overall, 198 patients were recruited over a 14-month period with a 60% uptake, and the majority of participants underwent a colorectal resection. Key findings from this study demonstrated that remote monitoring is a feasible method for assessing individuals in a preoperative at-hospital setting. Participants tolerated the device well, with only one adverse event being reported. 93% of participants achieved a minimum of 48-hour wear time, and generally engagement with the system was strong, exceeding expectations. The system received an excellent usability score of 80.1. However, some challenges were identified with disconnections and adhesion issues, which highlights the need for a structured support system for troubleshooting through these challenges to minimize data loss. Additionally, wearable data analysis with machine learning models achieved a good agreement with VO2 predictions in both linear and logistic regression approaches as demonstrated in the two graphs. In summary, remote monitoring is a feasible and safe approach to risk assessment with the potential to complement CPET, but further research is required to validate our results before its widespread adoption. Thank you.